Hello, this is Dr. Alex Samuel, Health Director for the Chesterfield Health District. It's hard to believe we're approaching the 4-month mark since COVID-19 really consumed the attention of myself and my staff. Health department staff have been focusing much of our recent efforts on testing, case investigations, contact tracing, and providing guidance to the community as reopening proceeds. You haven't heard from me since May the 27th. Board of Supervisors update, primarily because these activities have proceeded without too many entanglements, and there hasn't been any major issues requiring an update. I thought I'd spend a little time today covering a few topics that are relevant right now. The first of which is recent trends and new case numbers in Chesterfield County on the VDH website. So there's a lot of data that describes the COVID-19 situation in Virginia, much of which is available at the locality level. You can find this data if you go to vdh.virginia.gov and then click on the link for COVID-19 in Virginia. This data includes new case numbers that are reported by day by locality, including Chesterfield County. And in the county, these case numbers have been trending upwards and include single-day jumps or spikes that can appear alarming. The first thing to note is that trend information is much more helpful than the daily case number, because the number of steps that must occur internally, which include confirming lab results and contacting cases, before a new case is added to the daily website total. In other words, the case numbers reported by day aren't necessarily real-time numbers. The cases reported on the website on any given day are often an accumulation of cases that we've received and processed over the past 5 to 7 days or so. So again, it's best to look at trends. Another thing to note is that when looking at the testing data for Chesterfield on the VDH website, there's a tab specific to testing. The percent positivity, which is the number of individuals who test positive, or the number of tests that are conducted over the course of the day, has remained fairly stable in Chesterfield County over the past 3 weeks. However, the amount of testing done in the county has increased a fair amount, which mathematically will lead to new case totals. So we're testing more and finding more cases, which has contributed to the upward trend. Another thing to note is we've also been conducting testing over the past several weeks in economically vulnerable communities, where we found many individuals who have tested positive, again, which leads to higher case totals. These cases are often processed and entered on the same day, leading to one-day spikes in new case numbers that are noted on the website as well. Another thing to note is that we aren't seeing large-scale outbreaks that would account for the new cases at a specific point in time, which is a good thing. New case numbers in long-term care facilities, for example, have dropped over the past month or so. So again, we aren't really able to account for spikes that way. It's not simply a large number of cases at one given outbreak. All of this leads to the possibility that some of the increase in new cases could be due to greater community transmission as reopening proceeds and people come together. This is a very real possibility, though it's very hard to tease these types of new cases out of the reports and the data that we're getting. The most important thing for everyone to note is that COVID-19 hasn't gone away. The University of Virginia model that VDH has been affirming projects an increase in cases statewide over the summer months, primarily because people are coming together with reopening. So this leads me to another point that I'd like to cover, which is since COVID-19 isn't behind us yet, we really need to continue being mindful of basic prevention reminders. The virus continues to circulate in our community and is still a serious threat to those who are elderly or who have underlying health concerns. So I'd like to remind everyone that we still need to practice, again, basic prevention to reduce the spread of COVID-19. And some of these steps include remembering that we're safer at home, especially those who are at higher risk of severe illness. It's also important to maintain appropriate social distancing, which means 6 feet between yourself and others. Also remember, it's also important to wash your hands often, especially when you return home from going out. stay at home if you're sick, and disinfect frequently touched surfaces. These are things that are not new to any of us, but very important to continue practicing. It's also very important to understand that you can spread COVID-19 to others even if you don't feel sick, if you don't have any symptoms. Remember that wearing a cloth face mask covering is required for indoor public spaces. And the whole point of wearing a cloth face mask is to prevent spread from yourself to others in the event that you are positive but don't have symptoms. The virus is thought to, again, spread mainly person to person through respiratory droplets produced when an individual coughs, sneezes, or talks. Therefore, it's one of those things that spreads within close contact, about 6 feet from you, or by touching a surface or object where these droplets have landed. The symptoms, again, it's always good to remember that the symptoms of COVID-19 usually are respiratory in nature. They can be mild or severe. And they can appear 2 to 14 days after exposure to the virus. Many people experience fever, cough, shortness of breath or difficulty breathing. Chills less frequent symptoms include muscle pain, sore throat, and a new loss of taste or smell. The final topic that I'd like to cover is what you and I should do if you are contacted by the health department, either because you tested positive for COVID-19 or you were a contact of someone who tested positive. This is a topic that is of relevance because of the cases that we're seeing. And it is very possible that if you indeed were exposed and test positive, or were exposed by somebody else who was positive, you could get a telephone call from a member of my staff. But depending on where you were tested, you could either be contacted by your healthcare provider or a health department staff member who will confirm your test results. If you test positive, the most important thing to do is to stay at home and isolate yourself from other people for a time period your provider or the health department staff member tells you to, which could be as long as 10 days. And this is true whether you have symptoms or not, again, because it's possible to spread the virus if you don't have symptoms. You should also let your employer know so that they can appropriately clean the workplace and otherwise prepare. It's also important to let your primary care provider know you tested positive if you were tested somewhere else. Following that, a case investigator from the health department will reach out to you, usually by phone, for a voluntary and confidential conversation. They'll ask you some pre-approved questions to understand more about you and your illness, and will work with you to create a list of all the people you may have had close contact with while you were infectious. This process helps to find people who may have been exposed to COVID-19. After all of your close contacts have been identified, a contact tracer from the health department will reach out to them and notify them of their possible exposure as soon as possible. When the interviewer calls close contacts, they do not tell them who it was who tested positive for COVID-19. This conversation is confidential to protect and respect your privacy. The health department will not share your name or medical records with your contacts without your approval. Now, if you have been identified as a contact to a case, the contact tracer cannot give you the name of the person who identified you as someone who might have been exposed to COVID-19. Again, that's to protect the identity of the individual who tested positive. To prevent the spread of COVID-19, people who have been identified as contacts to a case should stay at home or self-quarantine and monitor their health for symptoms of COVID-19 for 14 days since their last exposure to the case. If you become sick, it's important to get tested and speak to a provider about appropriate medical care. So I hope this information was helpful. We'll continue to put out updates on pressing matters as they arise or other relevant topics from time to time. Thank you.